The second abstract is an update from the children point of view of the GIMEMA registry that was set in 1913 with the aim to harvest as more information as possible about pregnancies and conceptions in people affected by CML. As you all are aware, CML up till the 21st century was a deadly disease that could be treated only and cured by allogenic bone marrow transplant. For this reason, it was very uncommon that people wanted or tried to carry a pregnancy. With the advent of the tyrosine kinase inhibitor, all this scenario completely changed. And of course, with the improving results that we have seen since the first years of treatment with the first generation TKI imatinib, it is true that the possibility to start again your life after the illness, go back to a normal life, could include the desire of planning and go ahead with a family. And since there were no information about it, this large registry has been set, and it has been the first big registry set throughout the Italian population. Usually we presented data on patients, seeing the fertility rate, the abortion rate, what happens to the CML since you have to stop treatment, and actually no one ever talked about babies. And so this time we wanted to be on the baby side, and for this reason we harvested the information of 194 pregnancies for 195 babies, and one is still ongoing, and see what was happening to the babies, not only at the moment of delivery and the immediate postpartum period, that is the one when you can see basically the malformations or the first big problems that are connected to the pregnancy, but also the development of the babies. So the babies were divided in 4 categories. The first was 0 to 3 years, that refers to the psychomotorial development. 3 to 5 years, that was the language development and the first socialization skills. The 6 years till 12 years, that are the scholar year, and so school performances and again socialization and so on. And after 12 years with the sexual development of the adolescent that is growing up. Since this was both a retrospective and prospective study, there were some babies that were studied for more than 12 years, and the majority, of course, belong to the lower categories. Some of the mothers were treated with TKIs during pregnancy, as again I already said, mostly with imatinib or nilotinib after the placental formation, or if needed with interferon throughout the whole pregnancy. There were no problems in carrying on a pregnancy. Also, the abortion rate was comparable to the general population. No malformation were seen. Some problems were observed, and we suggested doctors to present any kind of problem. So you can see also the jaundice or some other small problems that are very common in the postnatal period. Anyhow, there were no major problems in those patients, nor small for date babies, even if the mothers were treated both with interferon and TKIs. One other important thing is that a few patients were breastfeeding while treated with interferon, and the babies had a very regular growth. We all know that interferon is not absorbed orally, and this confirms that there were no problems. Also, another aspect that has been considered is in vitro fertile insemination and oocyte harvest that seem not to be jeopardized by TKI therapy, but this is something that maybe we will exploit a little later.